In this video, I'm going to be talking about sitting postures. The way you sit can do a lot to your health, and especially nowadays people use computers or cell phones. A lot of people forget how to sit properly. So in this video, I'm going to be sharing with you some tips regarding sitting postures. First of all, let me talk about a couple common mistakes or common bad postures. Number one, slouching. Slouching is very common nowadays, especially when we're looking at the cell phones or if we're using a computer where the screen is too low so that we have to slouch down in order to see it clearly. However, that is not good for your health. Let's try this. First of all, sit upright and then we'll do 2 breaths. 1, 2. And then now you can try slouching down and then do 2 breaths as well. 1, 2. And now it's obvious that when you're slouching down, you cannot breathe in deeply. And also, when you're slouching down over time, it could cause tension and stress in your muscles and spine. And then it could eventually lead to neck pain, muscle pain, shoulder pain, or even lower back pain. And in addition, because you are contracting, so which means the qi, your energy or your blood cannot flow smoothly in your body. And if the circulation is bad, that does no good to your health. Number 2, leaning back. A lot of people like to lean back because it is relaxed, it's comfortable. However, that puts a lot of stress on your neck and lower back, as you see. And also, you're sitting on your tailbone, which means you're putting a lot of pressure on your tailbone. But the correct way to sit is to put pressure on the sit bone instead of the tailbone, as you see in the picture. Number 3, crossing the legs. Crossing the legs are not good as well because it causes a tilt and rotation of your pelvis. In order to balance that, your muscles have to work extra, and eventually it could cause lower back pain or a misalignment of the spine. And in addition, studies have shown that crossing the legs could temporarily increase the blood pressure. So especially for people who have high blood pressure, try to avoid crossing the legs as much as possible. So how exactly should we be sitting? Let me explain it from bottom to top. First of all, the foot position. The feet should be flat down and the knee is about 90 degrees angle. And the hips and knees should be perpendicular to the ground. Bring your hips all the way back to the chair, and if needed, put a pillow or roll a towel or even use a lower back support to maintain the natural arc of the lower back. Because your spine is not totally straight, it has a natural arc. Imagine there's a string on top of your head. Chin in, the string pulls up so that your upper body is straight. If you are too tall so that your knee is over your hip, what you can do is to either elevate your chair or put something under your hip, such as a pillow, so that it can elevate so your knees are right at 90 degrees. But if the chair is too high so that your legs are dangling, what you could do is to put a stool under your feet or even adjust the chair as well. In Chinese medicine, if we're sitting too long, even we're sitting at a good posture, it could affect the spleen function. And spleen here means your digestive function and your muscles, because spleen governs digestion and governs the muscle. And if we're sitting too long, it could affect that. So which means when we're sitting for too long, what we should do is every 20 to 45 minutes, we should be standing up, stretch a little bit, walk a little bit, and that could relieve the pressure. 20 to 45 minutes, it depends on the body. For example, for someone who has a lower back pain, then obviously they should be standing up and relaxing more often than people who are healthy. Sitting properly can develop your upright qi. And upright qi is important because it can not only nourish all your organs and make you healthy, but it can also be a defensive function and prevent any external pathogens from attacking your body. In conclusion, posture is really important. Although it does not cause any medical emergencies, but it could cause a lot of effects on your health over the long term. And for me personally, I admit that sometimes I do slouch, sometimes I do lean back, but that is okay. I think the most important point is to be aware and conscious and keep reminding yourself so that your bad habits could be corrected one day. Thanks for watching today. If you have any questions, leave in the comment section below. Stay healthy and I will see you in the next video.